Hello, I'm Ramesh Aralikatte. I have over 30 plus years of experience navigating the healthcare system, not as a doctor, but as a patient.
Hey everyone, welcome back to the channel. Today we're tackling a topic that's incredibly personal for me and millions of others living with diabetes, diabetic neuropathy. So, what is it? Simply put, it's nerve damage caused by high blood sugar levels over time. This damage can lead to a whole range of uncomfortable and sometimes debilitating symptoms like numbness, a pins and needles tingling sensation, or even sharp burning pain, most commonly in the feet and hands. For me, it started as a subtle numbness in my toes that I initially brushed off. It's a silent complication that can creep up on you, which is why talking about it is so important. The good news is, while there isn't a cure just yet, there are many effective ways to manage it. The core of any treatment plan is twofold. First, we focus on managing the symptoms to improve your quality of life, and second, we work on slowing down the progression of the nerve damage itself. This involves a comprehensive approach that looks at the underlying cause, the diabetes. It's not just about popping a pill. It's about a holistic strategy that empowers you to take control. Throughout this video, we'll explore the top treatments, from foundational lifestyle changes to cutting-edge medical interventions, to give you a complete picture of what's possible. Before we dive deep, I have to make a very important disclaimer. Always consult your healthcare provider for personalized advice. I'm not a doctor, but a long-term diabetes patient sharing my journey and the research I've gathered along the way. Your situation is unique, and what works for one person might not be right for another. Please consult your physician and neurologist before starting any treatment. My goal here is to arm you with knowledge so you can have more informed conversations with your medical team. Let's get into it. All right. Let's start with the absolute cornerstone of managing diabetic neuropathy: tight glycemic control. I cannot overstate this. Think of high blood sugar as a constant, low-grade poison to your nerves. Over time, it damages the tiny blood vessels that supply your nerves with oxygen and nutrients, leading to the symptoms we've talked about. So, the most powerful thing you can do to slow down, and in some cases even prevent further damage, is to get those blood sugar levels into a healthy, stable range. This isn't just theory. It's backed by landmark studies like the Diabetes Control and Complications trial, which showed that intensive blood sugar management dramatically reduced the risk of neuropathy in people with type 1 diabetes. The evidence is clear. Control your glucose, protect your nerves. So how do we achieve this tight control? It's a multi-pronged attack. First is diligent monitoring. Whether you're using a traditional finger prick glucometer or a continuous glucose monitor, knowing your numbers is non-negotiable. This data is your roadmap. Next is diet. This doesn't mean you can never have a slice of cake again, but it does mean being mindful of carbohydrates, focusing on whole foods, lean proteins, and healthy fats. Medication, as prescribed by your doctor, be it insulin, metformin, or other oral agents, is the next critical piece of the puzzle. It's about working with your endocrinologist to find the right regimen that keeps your A1C in its target range. Finally, let's talk about exercise. Physical activity is like a secret weapon. It not only helps lower blood sugar by increasing insulin sensitivity, but also improves circulation to your extremities, which is fantastic for nerve health. Even a brisk 30-minute walk most days of the week can make a significant difference. It's the synergy of all these elements, monitoring, diet, medication, and exercise, that creates the strong foundation needed to fight back against neuropathy. It takes discipline and consistency. I know this firsthand. But every single effort you make is a direct investment in your long-term health and well-being. While controlling blood sugar is our long-term strategy, the day-to-day reality for many of us is pain, tingling, and numbness that need immediate attention. This is where medications for symptom relief come into play. These drugs don't repair the nerve damage, but they can significantly turn down the volume on those painful signals your nerves are sending to your brain, making life much more manageable. The most commonly prescribed medications fall into a few classes. Anticonvulsants, originally developed for seizures, have proven very effective for nerve pain. You've likely heard of gabapentin and pregabalin. They work by calming down overactive, damaged nerves. Another major class of drugs is certain types of antidepressants. Specifically, serotonin-norepinephrine reuptake inhibitors like duloxetine and tricyclic antidepressants like amitriptyline have been shown to be effective for neuropathic pain. They work by altering the chemical messengers, or neurotransmitters, in your brain that are involved in perceiving pain. It's important to understand that these are prescribed for their pain-modulating effects, not necessarily because you have depression, although the two can unfortunately coexist. Finding the right medication and the right dose is a process of trial and error, and it's something you have to do in close partnership with your doctor. The key thing to remember is that these are powerful medications with potential side effects, which can include dizziness, drowsiness, or weight gain. This is why you never just start or stop them on your own. Your doctor will likely start you on a low dose and gradually increase it to find that sweet spot where you get maximum symptom relief with minimum side effects. For more localized pain, topical treatments can also be an option. Things like lidocaine patches or capsaicin cream, which is derived from chili peppers, can provide relief directly at the source. The journey to find the right pharmacological solution requires patience and open communication with your healthcare team. Medication is a huge help, but it's only one piece of the puzzle. There's so much we can do through our daily habits and non-pharmacological therapies to support our nerve health and manage symptoms. Let's start with exercise again, because it's that important. Beyond its blood sugar benefits, specific types of exercise like balance training and Tai Chi can improve stability and reduce the risk of falls, which is a major concern when you have numbness in your feet. Gentle, low-impact activities like swimming or cycling are also fantastic because they improve circulation without putting excessive stress on sensitive feet. The goal is to stay active in a way that feels good and safe for you. Next up is something I'm very passionate about: foot care. When you have neuropathy, your feet become incredibly vulnerable. A small cut or blister that a healthy person might not even notice can become a serious infection for us because we may not feel the initial injury. It is absolutely critical to inspect your feet every single day. Look for cuts, sores, redness, or swelling. Wash them daily in lukewarm water, dry them carefully, especially between the toes, and always wear well-fitting shoes and socks. Never ever go barefoot. This daily ritual isn't just a chore, it's a vital act of self-preservation that can prevent serious complications like ulcers and amputations. Beyond that, there are other supportive strategies to explore. Physical therapy can be incredibly beneficial, with therapists designing specific exercises to improve strength, balance, and function. Some people find relief with TENS, or transcutaneous electrical nerve stimulation, a device that uses low-voltage electrical currents to disrupt pain signals. And while the evidence is still developing, some studies suggest that certain dietary supplements, like alpha-lipoic acid or B vitamins, may help support nerve health and reduce symptoms. Again, this is not something to start on your own. You must discuss any supplements with your doctor to ensure they're safe and won't interact with your other medications. When we talk about diabetic neuropathy, we often focus on the peripheral nerves in our hands and feet. But diabetes can also affect the autonomic nervous system, the network that controls all our involuntary bodily functions, like heart rate, blood pressure, digestion, and bladder control. This is called autonomic neuropathy, and it can lead to a whole different set of challenging complications. For instance, it can affect your cardiovascular system, causing something called orthostatic hypotension. That's when your blood pressure drops suddenly when you stand up, leading to dizziness, lightheadedness, or even fainting. Managing this involves simple but effective strategies, like rising slowly, staying well hydrated, and sometimes wearing compression stockings. The digestive system is another common target. Autonomic neuropathy can lead to gastroparesis, a condition where the stomach takes too long to empty its contents. This can cause nausea, vomiting, bloating, and unpredictable blood sugar swings because food absorption is delayed. Management often involves dietary changes, like eating smaller, more frequent meals that are low in fat and fiber, and medications that help stimulate stomach emptying. It's a tricky condition that requires close coordination between you, your primary doctor, your endocrinologist, and sometimes a gastroenterologist to get right. Finally, autonomic neuropathy can impact sexual function and bladder control. For men, it's a common cause of erectile dysfunction. Thankfully, there are many effective treatments available, from oral medications like sildenafil to other options that a urologist can discuss with you. For both men and women, bladder issues can arise, ranging from urinary incontinence to difficulty emptying the bladder completely, which can increase the risk of urinary tract infections. These are deeply personal issues, and it can be hard to talk about them, but it is so important to bring them up with your doctor. They've heard it all before, and there are tailored interventions, from behavioral strategies to medications, that can make a huge difference in your quality of life. Now, let's look to the future. While the current treatments focus on managing symptoms and slowing progression, researchers around the world are working tirelessly on therapies that could potentially reverse nerve damage or even cure neuropathy. This is the exciting, cutting-edge stuff. One of the most promising areas is neuromodulation. This goes beyond the simple TENS units we talked about earlier. I'm talking about more advanced technologies like spinal cord stimulation. This involves implanting a small device that sends electrical impulses directly to the spinal cord to interrupt pain signals before they even reach the brain. It's more invasive, but for people with severe, intractable pain, it has been a life-changing option. Another exciting frontier is regenerative medicine. This field explores the body's own ability to heal and repair itself. Researchers are investigating the potential of stem cell therapy to regenerate damaged nerve fibers. The idea is to introduce healthy new cells that can replace the ones destroyed by high blood sugar. Similarly, they're looking at using specific growth factors, proteins that stimulate cell growth, to encourage damaged nerves to regrow and restore function. While this research is still largely in the preclinical or early clinical trial phase, it represents a fundamental shift from managing symptoms to actually repairing the underlying damage. Finally, there's the incredibly complex field of gene therapy. Scientists are exploring ways to deliver new genetic material into cells to correct the abnormalities that contribute to nerve damage. For example, they might try to introduce a gene that increases the production of a neuroprotective protein. These approaches are still highly experimental and a long way from being available at your local clinic. But it's important for us, as patients, to know that the scientific community is pushing the boundaries. These emerging treatments offer a powerful dose of hope that one day we might be able to do more than just manage neuropathy. We might be able to overcome it. Beyond the world of conventional medicine, many people with neuropathy look to complementary and alternative therapies to supplement their treatment plan. It's important to approach this area with a healthy mix of open-mindedness and skepticism. Let's start with one of the most well-known: acupuncture. This ancient Chinese practice involves inserting very thin needles into specific points on the body. Some small studies and a lot of anecdotal reports suggest it can help reduce neuropathic pain for some individuals. The proposed mechanism is that it may stimulate the release of endorphins, the body's natural painkillers, and improve blood flow. If you consider trying it, make sure you go to a licensed and experienced practitioner. Next, we have mind-body techniques. The chronic pain and stress of living with neuropathy can take a significant mental toll. Practices like meditation, mindfulness, yoga, and biofeedback can be incredibly powerful tools for managing the psychological aspect of the condition. They won't regrow your nerves, but they can change your relationship with the pain. By calming the nervous system and reducing stress, you can lower your perception of pain and improve your overall sense of well-being. I personally have found a daily meditation practice to be invaluable for managing the day-to-day frustrations of living with a chronic illness. Finally, a quick word on a topic that's getting a lot of attention: cannabis-based treatments, like CBD and medical marijuana. There is some emerging evidence that cannabinoids may help with neuropathic pain, but the research is still very limited and often of low quality. Furthermore, the legal status varies wildly from place to place, and the products on the market are often unregulated, meaning you don't always know what you're getting. This is an area where you absolutely must proceed with extreme caution and have a very frank conversation with your doctor, weighing the potential benefits against the risks and legal considerations in your area. We've covered a tremendous amount of ground today, from the foundational importance of blood sugar control to the exciting future of regenerative medicine. If there's one thing I want you to take away from all this, it's that managing diabetic neuropathy is a marathon, not a sprint. It requires a personalized, multifaceted approach. Remember, no single approach works for everyone. Work with your healthcare team to find the best plan for you. What works for me might not be the right path for you, and your plan will likely evolve over time as your needs change and new treatments become available. Stay engaged, ask questions, and be an active participant in your own care. The journey can feel overwhelming at times, I truly get that. But every healthy meal you choose, every walk you take, and every doctor's appointment you keep is a victory. Regular monitoring and healthy lifestyle choices are key. They are the most powerful tools you have to protect your health and improve your quality of life. Don't get discouraged by setbacks. Just refocus on the next right step you can take. You have the power to influence the course of this condition, and you are not alone in this fight. Thank you so much for spending this time with me today. I hope you found this guide helpful and empowering. My goal is to build a supportive community here where we can share experiences and learn from one another. If you want regular updates, please like, share, and subscribe to my channel. It really helps get this information out to more people who might need it. Drop a comment below and let me know what strategies have worked for you. Stay strong, and I'll see you in the next video.